brochure you've just been looking at is for MamaNatalie. MamaNatalie is a new birthing simulator from Letourneau. It comes with a two-part system. The actual birthing apparatus, the MamaNatalie portion, as well as a neonate simulator called NeoNatalie. Really what MamaNatalie and the birthing system has been designed for is to be an easy-to-use birthing simulator that will allow you to simulate anything from a normal delivery all the way up to a complex delivery. It's just kind of what's your objective and what you want to accomplish. How it works is the instructor will strap on the delivery mechanism here, the MamaNatalie portion, just straps around, and then as the instructor I'm going to be able to manually simulate and control the delivery. I'm going to be able to simulate fetal heart sounds. I'm going to be able to simulate the delivery of placenta, both complete and incomplete. I'm going to be able to simulate uterine firmness, different levels, as well as intensity of blood. There is a fluid reservoir. We will be able to get fluid outflow. We can have it bleed a little, we can have it bleed a lot. Is it a simple delivery where we don't have a lot of blood, or is it more complex? Is it a retained placenta? Do we need it to bleed a lot? Postpartum hemorrhage. We can accomplish all of this with this easy-to-use birthing simulator. For the learner, they can also practice urine catheterization, as well as the simulation of drug administration. As far as the neonatal simulator goes, we can simulate the sound of a newborn baby crying. We can have spontaneous chest rise, so visually the learner will see the chest go up and down, and palpable pulse. They will be able to feel the pulse pulsating. So how does this work? Well, as you can see, all the components are right here in front of you. Comes in a nice backpack package, so it's easy to transport, easy to store. No limitation, you don't have to schedule a sim lab or a dedicated room. You can have it set up as a skills station. People can come practice when they want. You could bring it into the classroom. Perhaps you're talking about a particular case study. Get your MamaNatalie out, there, boom, right in front of the class. You can have a 2-minute, 3-minute, 5-minute overview of whatever you're trying to discuss that day. Is it the actual delivery? Are you talking about postpartum hemorrhage? Just really easy to kind of manipulate and use where you see best fit. So as the instructor, again, I'm just going to strap the apparatus around my waist. In preparation, there's a reservoir on the inside that's been filled with fluids. If I am going to use fluids, I want to make sure that I have a reservoir container and a fluid drain guide. This has Velcro. I'm just going to Velcro it on the underside here. Make sure it's landing in my reservoir tank, and then any fluids that would come out are just going to go directly into that reservoir. We're not going to do that today because we're up and down doing a ton of these demos. So, as the instructor, I've got my birthing MamaNatalie apparatus on. I'm going to unfold the top portion. Then it comes to the baby. NeoNatalie here has been filled with water. So she has a very realistic weight and feel to her, and her umbilical's been attached to the placenta. So I am just going to position my baby into the birthing canal for whatever type of position I am trying to accomplish. Make sure that we take our placenta, which has Velcro on the back. There's a Velcro mate on the inside. We make sure it's secured. See? Tuck in my cords. Going to cover it up. We've got some sides that we can zip up a little bit. Top portion goes around. Then as the instructor, as I said earlier, we can simulate fetal heart tones. I can simulate contractions. There's a reservoir that's filled with air on the inside that I just squeeze with my hand, and the learner can feel different types of urine contractions and firmness. And then as the instructor, I just have two little kind of handles on the inside that I use for guides, and then I'm able to just guide and push that baby through the canal, depending on what kind of delivery. Do I want it to be simple? Do I want it to be more complex? It's really kind of what you want to achieve. And you can have the head present. You can see it's coming. Obviously, I'd have someone on the other end to help guide and deliver this little baby here. But as you can see, it's coming out, and I'm just guiding it through. Oh, and we have a newborn baby here. What happens when we have a healthy newborn baby? We cry a little bit. You can see that our cord's still attached, so we have to finish delivering. The learner will pull a little bit more. Me, the instructor on the inside, is just going to make sure when the time is right, I take that Velcro section that we talked about, and I make sure it comes unvelcroed, and then we're able to go in and deliver the placenta. So they're just going to continue to pull the cord here. and out comes the placenta. Now that's a complete placenta. If we wanted it to make it more difficult, we would make sure that when we pulled it, they had part of it stay intact, so then they'd have to go through the more complex delivery process. That's just a brief demonstration so you can see kind of the mechanics and how it would work. It shows you that it's very easy to use, it's portable. When I'm done, I just unattach it, pack it back up, and use it when I need to. Again, it comes with MamaNatalie, your fluid reservoir, as well as neonatally, the actual birthing simulator, the placenta, simulated blood, and some other adjunct tools to help complete the entire birthing experience. We're talking about a full birthing simulator, less than $800. Throughout 2012, for every one MamaNatalie set that's purchased, Letourneau Americas will also gift one to developing countries. And it's really just in alignment to what Letourneau is all about. Anyone that knows Letourneau, we're all about helping save lives. Our vision, in fact, is to make sure, that nobody dies unnecessarily due to birth or from sudden illness or trauma. Any questions? Thank you. Appreciate your time today, and I'll make sure I get you some additional literature and follow-up.